Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, Hafa and welcome back, everybody. This is Healthy Living Tuesday, of course, and our good friend Dr. Jitka Lom from Express Care is here, and she is sharing with us knowledge and tips about breast cancer and breast exams in particular. So we have a bunch of Facebook questions. People went to KUN.com/Facebook, and they pose those questions. You ready?
Yes.
Okay, well, here we go. Question number 1 comes to us from the central village of Sinanya, and this comes from Annie W. Annie asks, Dr. Lom, is a mastectomy a better treatment for breast cancer than a lumpectomy, and maybe differentiate between the two?
Okay, so when a breast cancer is found, the important thing is to remove the primary, that means the actual tumor that's found in the breast. And it can be very small, like a pea size, or it can actually be really large, especially if the woman hasn't been checking and suddenly she discovers it's something the size of a fist or even bigger. So if it's a very huge tumor, then the whole breast needs to be removed. But that's a very tragic and unpleasant thing for the woman and a big surgery. So studies have been done to find that actually lumpectomy, taking out just the lump, or so-called breast conservation surgery, where you basically just remove as little as possible while removing the tumor, works just as well as removing the whole breast in most cases. It depends on the type of tumor also. But in general, a lumpectomy is just as fine. Some women, when they've been diagnosed with breast cancer, would like to just never have to deal with that again, and they want their entire breast removed. But for most, just a lumpectomy is okay.
Okay, now obviously that's a very sensitive topic to bring up to any woman or man.
Yes.
Okay. Question number 2 does not have an author. This person preferred not to leave a name, but this person says, Dr. Lom, during a self-examination, I found a lump in my breast. Should I be worried? We talked about that during the first
We did. And it depends a little bit on your age. If you're a young person, let's say under the age of 50 or so, most likely it's nothing, but you should still have it checked. The statistics are something like 80% of breast lumps that walk into a doctor's office are not cancer. So that's a really good thing. The things that would make you more concerned is if it was a new lump, it was rapidly growing, it was very hard, and of course, if you have a strong history of breast cancer, either in the family or you've already had breast cancer, then you really, really need to get it checked.
Okay, good information. Back to our Facebook questions, and this is our third one of the evening on the topic of breast self-examinations and breast cancer. What, if any, this person asks, are the side effects of tamoxifen?
So first of all, tamoxifen is a drug that we use to prevent breast cancer. So in women who've already had it, they go on a regimen of 5 years of tamoxifen every day for 5 years to help them get through that so-called survival time of 5 years after their diagnosis. That's to prevent recurrences. In women that have a super strong family history of breast cancer, or they've had sort of like a pre-cancer, they can go on tamoxifen to prevent cancer altogether. And then the question is, what are the side effects? This drug limits the amount of estrogen that can interact with your breast. So it blocks estrogen as it affects your breast, but it does not block estrogen as it affects your uterus. So one of the more serious side effects of it is polyps or uterine cancer, that's of the womb. Other side effects are hot flashes, that's a very common one, more tendency towards blood clots, including the type that would go up into your lung, sometimes nausea or vomiting. The most uncomfortable for women is hot flashes. It's kind of like going into menopause all of a sudden.
So of course, before you consider any of these medications, of course, they would have to be prescribed, but consult your local neighborhood physician like yourself or any of your colleagues.
Of course, this would be prescribed by your oncologist, meaning your cancer doctor.
There you go. Okay, question number 4 is from down south. Veronica from Minarahan asks, Dr. Lom, what is the proper way to do a self-examination? I'm sure you could find this online. Or
you can, but it's always good to review, and it's good to teach your daughters when they're young. You know, teach them in high school. So basically, look at your breasts in the mirror once a month after your period has passed. Make sure they look normal, that there's no unusual skin changes, that the nipples look normal. Then use the flat part of your fingers to go around the breast like a clock. So you're gently massaging, going around the breast from 12 o'clock to 1 o'clock, 3 o'clock, like that. Just gently looking for any lumps, and you may find some, and that's okay. Check the other side. If you find the same thing on the other side, you're fine. If it's not matching, it's hard, it's suspicious, then you're going to get it checked. So you're going all the way around the clock, everything's fine. Then you check the nipple, just gently squeeze, look for any blood coming out, and at the end just also check right in underneath the armpit for any lumps or bumps that might be there. So it'll take you all of 2 minutes in the shower or lying down in your bed, making sure that you're healthy.
All right, well, our last question is also from down south, and this is Francis from Agate. Real quickly, Dr. Lom, Francis asks, is there a high rate of breast cancer on Guam?
Well, our statistics are a little bit incomplete, but from 2003 to 2007, that's the 4-year latest statistics that we have, there were about 200 diagnosed cases of breast cancer on Guam in those 4 years. So that would average to about 50 per year. From 2007 and up, I don't have the numbers, but there is a cancer registry on Guam at the university, and they collect the data. So we'll know how things are coming along.
Okay, is there, real quick before we end this segment, is there any chance of going back to the lumps of women that are athletically active, or, they may have had enhancement surgery or, implants?
Yeah, implants. Well, it's important to have a mammogram before you get the implants and make sure they're, that your breasts are okay. But the implants themselves have no relationship to breast cancer. It just might be a little harder to find the breast cancer because you can't have a mammogram. You have to have an MRI or an ultrasound, and the cancer might be hiding behind your implant. Okay. That would be the only risk.
Okay, well, Dr. Lom, thank you so much once again for your information. People can always contact the good doctor and her colleagues over at Express Care. And Dr. Lom will be back here again next Tuesday when our topic will be antibiotics. Always an interesting topic, so make sure to go to our Facebook wall at KUAM.com/Facebook. Post your question, and it will appear right here. As for right now, Healthy Living Tuesday continues right here on KUAM Extra. Sit tight, we're back.